The vaccines weren't rushed. The mRNA technology on the Pfizer-Moderna vaccine has actually been developed over 10 years. So this is a long time in the making. It wasn't specifically for this particular COVID, but it was after the initial SARS outbreak that we saw many years ago. And these vaccines have been around for a while and in development, and they have not been rushed. The emergency use authorization was a way to cut away some of the bureaucracy and get these vaccines to the public quickly, because we were in an urgent pandemic. People were dying every day. When the vaccines came out, the death rate in the United States was 3,000 people a day. That's a 9/11 every single day from COVID. They removed some of the bureaucracy, but as far as safety goes, they're following their normal process. We just got FDA approval from Pfizer. We expect the Moderna FDA approval really coming very quickly, followed by the Johnson & Johnson. These vaccines have been given to over 5 billion people worldwide. There is nothing that I'm aware of in healthcare that we've studied so closely, given so many people, and seen such safety and efficacy at the same time. So they're highly safe, highly efficacious vaccines. I've taken them, we've all taken them, given them family members, friends. I can recommend them without reservation.
There's a funny thing. There's a funny irony I want to talk a little bit about, and that is there's some people out there who might be listening to us who are like, I don't trust them when they're talking about the vaccine. For some reason, there's this distrust. It's like, well, we're medical professionals, right? And just about all medical professionals are recommending these vaccines to protect you and keep you safer, right? A public health recommendation. And then those same individuals, if they get COVID and sick, they come into the hospital to us for care. It's like, well, why do you trust us then to provide care to you? It's like, it's a little ironic that you would turn to us when you're sick to come for care. Why would you come to the hospital if you don't trust us now, right? Please trust us. Any medical professional who spent their career in medicine, and let's talk about experts and deference to expertise, right? You can only be expert in very few things. And I wouldn't even call myself, I wouldn't claim to call myself an epidemiologist, okay? But I do have some expertise in medicine. And so that deference to expertise, trust us now when we say the absolute best health decision that you can have and make today is to get vaccinated against the coronavirus with one of these safe and efficacious vaccines, right? It is absolutely the best health decision you can make for yourself. Trust us now, not when you get sick and need to come into the hospital for care when it's already a little too late.
Yeah. I think it's really important that we talk about where our goalpost is. I think we've definitely moved. At one point in the beginning of the pandemic, we were all looking for something as our community and our loved ones. And we were all watching as people were just dying and dying and dying. And we were looking for something to say, please help us to stop dying just as a society. And somehow we've gotten from help us so that we're not dying to help us. And we found something, help us so that we're not being hospitalized. And now somewhere we're all the way towards the end and now saying, I don't even ever want to get sick. So if it's not going to prevent me from completely not getting sick, I don't want to take it. I just want us to remember as a community how far we've come in that short time frame and how grateful we should be that we have this opportunity to say, you don't have to die anymore. We don't have to do this. So just want to be mindful about what our goal is as a society. Is it to stop dying, or I don't want to have the sniffles?
Nearly 2,000 people a day are dying as of this point from the Delta variant that is, ravaging this country right now. That is a lot of people every day dying in this country, and it 100% are preventable.
Let's talk about the impact, like how many people have died of COVID-19 since the pandemic started in the United States, right? And if you added up all of the combat deaths in every U.S. war ever fought, the Revolutionary War, World War I, World War II, Vietnam, Afghanistan, put every war the U.S. has ever fought, that in the Civil War, add up all the combat deaths, right? And all those wars together, we have just about reached that same number with the coronavirus in the last year and a half. I mean, it's absolutely incredible, the devastation that this virus has caused in our country. And we have a way of preventing it now, that devastation. And so it's why I just, a lot of people are talking now about, we just got to do what's right. Everybody has to do what's right. Put aside the politics and the other thinking, right? We have to do what's right, right? It's a responsibility we all have, not just to ourselves, but to one another, right? To our civilization and society. It's a responsibility we all have.